Welcome to Med Medicine with Miss P. This should be a quick one also. When we get into CHF and EKGs and heart failure and all kinds of stuff, it may run a little bit longer. But today I'm just going to do H2 antagonists. We'll talk a little about H1s also. So once upon a time, a brilliant anesthesiologist I used to work with told me, I can't remember what the subject was, but we got onto histamine response in general, that your body thinks the solution to pollution is dilution, right? My students have heard me say that 100 times over. So whether you sprain your ankle, you have gastric issues, or pollen is bothering you, your body kind of floods the area, which makes perfect sense. If your cat pees on the rug, you don't mop it up with a cloth, spray a little something on and call it quits. It's cat pee. You take the rug outside and either burn it, or like what I do is I make my husband pressure clean it on the wash rack at the barn. So same thing with your body. Your body thinks that the solution to pollution is dilution. It's going to flood it. So if you twist your ankle and that's kind of, external pollution from trauma, it's going to blow up like a balloon and you have to elevate it and all kinds of stuff because your body's going to flood it with fluid and, start the lymphatic system working on, clearing it up and taking care of it. So that's kind of what your body's supposed to do. So whether you have an H1 antagonist, which means runny eyes, runny nose, cough, irritation in a H1, a histamine 1 response, you'll take an H1 antagonist, right? Like Benadryl, Claritin, Zyrtec, all of the norms. And that's what's going to dry up your secretions. So everybody wants to chart on their med list that they're, nursing considerations, is watch for dry mouth or blurred vision or that sort of thing. You're going to get that. You're going to get those things because that's what H1 antagonists do, is that they dry you up. That's the whole point of those. So whether you have an H1 or an H2, those H2 antagonists are the same thing. Pevsid, Prevacid, Prilosec, Nexium, Zantac, Protonix, they all are going to do the same thing and decrease the gastric secretion and production, of those acids. So same difference is they're going to dry you up. So the issue here is that, if you don't eat the things or do the things that cause that irritation, you may not ever need an H2 antagonist. But if you've got somebody on one, same thing with the nursing considerations, good God. Quit looking for bloody stools. You are way too late if you think that after you give your 20 milligram Pepcid, you're going to go check their butt for a bloody stool. The point is, the risk of a GI bleed is present if somebody is on an H2 antagonist. Just like metoprolol on CHF, you're not going to go check for crackles. You would look for that stuff anyway. At what point do you wipe someone's butt and think, oh, there's a cold blood, that's weird, and then just, continue wiping, clean them up, and call it a day? You would immediately notify somebody, and we would go looking for that bleed and do something about it. So same thing, when it says like, watch their iron level or that sort of, those types of issues. What I would do is if somebody is on an H2 antagonist, I would look for the things that are causing them to need an H2 antagonist. The number one most common thing we see, especially in long-term care facility, is what do you do with that patient after lunch? What do all the techs do with the patients after lunch? Yeah, they lie them back down. And then you wonder why everyone has heartburn, GERD, and, all of those issues. Stop doing that. Always stay up in an upright position about an hour after you eat. So same thing with your patients. Don't let them lie flat after they eat whatever greasy, nasty crap that, people are eating now. And also watch the portion size. Don't overeat. Like Ellen DeGeneres says, we shouldn't be eating like we were bears. We shouldn't be eating all you can eat. You should be eating until you're full and then stop eating. So when they are, overeating, you're going to have those GERD results also. And not only just portion size, but they should be drinking while they're eating. It's really important that you drink as much food as you can to help flush it through and, fill your stomach, and it can get through that next sphincter and get into your esophagus and move on down the line. And you're not just completely filling your stomach and, with food that can't move because it's not liquid enough. So drink as much as they can with a meal, watch portion size, and obviously they shouldn't be eating things that are greasy, spicy, or fatty, causing those GERD-like reactions. So, those are kind of common sense nursing considerations. Now, you can look for occult blood and gastric pain and you're always going to assess for GERD, because if they're still having those symptoms, then obviously that medication is not doing the job. So you want to try something else. but at least you know that the point of someone on these meds isn't just to look for the adverse reactions or side effects of the medications, but to actually find out why they're on it and to limit those things that are causing the patient to need to be on it. Just like anybody that's on Lasix, you're not going to let them eat a salty, messy, fluid filled whatever, because those are the things we're trying to limit. Most of those patients are on a low salt or fluid restriction diet because their kidneys aren't working correctly. So you try to overload their kidneys and then give it a pill to ask the kidneys to work better when they're not working well to begin with. It just doesn't make any sense. So use a little common sense here and think about why your patient's on those medications and then what we can look for. Now, I will say what you also need to look for are all the things that those H2 antagonists cause. I'm not saying don't take them. I'm not saying that they're not helpful. I'm saying that once upon a time, back in my day, not everybody on earth was on an H2 antagonist, and there was basically no such thing as C. diff or all those other issues. And my example that I always tell my students is I had a horse with, all performance horses are going to have some level of ulcers or gastritis, that sort of thing, because they're not meant to do those practices. So when you kind of ask a lot out of them, it takes quite a bit of care to help limit those. Some of the horses are really good about not having emotional issues that carry on and manifest in their GI tract, but your average performance horse will tend to have some sort of response to those acupressure points for GERD or gastritis, ulcers. I'm sure if we scoped every performance horse, they would probably have ulcers and other issues. But what I thought was a little scary is I can't remember exactly how it went, but I think a vet or something told me to do, like the U-Guard or the Pepsid, which was like, or the Pepsid, famotidine, I can't remember. It's like $30 a tube, and they're like, well, just do 1 tube a day, for 2 weeks and see how they do. And I'm like, I'm not great at math, but yeah, that's going to be a hard no. Like, when do I stop doing that? And then I talked to somebody who is a fabulous trainer in South Florida. My best friend kind of led me to her, and I think I read an article or something she put on there. Maybe I even texted back and forth. I can't remember, but she really kind of opened my eyes to something pretty terrifying. And she's like, if you put them on an H2 antagonist, which stop gastric acid production and secretion, and then you turn them out and let them eat off of the ground, what do you think they're going to start ingesting that they do not have the acids to destroy? What type of worms and parasites and other dangerous bugs are they going to ingest, and they do not have the acids there to destroy like they're meant to have, as horses should be grazing 24 hours a day? I thought, well, crap, that's kind of scary. What should I do? And she's like, baking soda. I thought, say what now? You mean the box? It's like, a good size box for 50 cents that lasts like 3 horses a couple weeks. I'm like, well, that's financially a better deal. And it also makes really good sense. And they really like the taste of it too. You don't have to fight them and squirt something down their throat. So I thought, okay, I'm in. So for, the last 10 years, I've been doing that. And not only do I have no more significant reactions to acupressure points for their gastric mucosa, but they all kind of gained a little bit more weight, and they're looking pretty good right now. I've also cut their feed in half. So that was a little interesting side note that has nothing to do with nursing students, sorry. But just wanted to let you know that look into these things and see how they work, and see how there's other things that may work a little bit better. So that's what's working for me. Also, you can always try apple cider vinegar for GERD. You don't have to just go straight to a pill that's got all kinds of funky side effects. I gave my husband a teaspoon of raw apple cider vinegar, like the mother with the floating stuff in it. So gross. I don't know how he downed it, but he really hasn't complained of GERD since. And now I know that sounds crazy because that was like 10 years ago too. So, and he doesn't take any medication for it. And he does feel like whoever eats the most wins, especially at like a buffet. He feels like he has to get his money worth and my money worth and her money worth and his money's worth. So we will sit there until like I'm bored. I'm already done playing on my phone. And like, are you finished with the peel and eat shrimp? It's not. You've already beat everybody. Everyone around us has left. You win. You can eat more than everybody else. Congratulations on your gluttony. Meanwhile, can we just go? Because I got things to do. So and the horses kind of do the same thing. They'll eat until they can't eat anymore. And that's the gastric mucosa for you. So let's not take it off. Let's try to see if we can't streamline it a bit. That's all there is to it. And your H1s, even on your paperwork, I really don't have much to say. You can look for dry eye and, from blurred vision, because with dry eye, you end up with blurred vision. Make sure they have enough fluids to drink and try to rehydrate, because the whole point of an H1 is it is going to dry you up. So I would expect those reactions. And again, I also wouldn't necessarily say don't take it, but there's always going to be mild side effects or miserable side effects to these antagonists. So that's that. Just pay attention to your nursing considerations. Quit writing stupid stuff from the book. Read the action of the medication. Think of how it works. Think of why they're taking it, and then what you would look for if things weren't going as they need to. You're always going to look for hemoptysis or occult blood or complaints of GI pain, and that would let you know if things were getting worse or better with H2 antagonists, obviously. So that's it. I don't even have a pet peeve necessarily, except just God, talking to patients on the phone lately. It's trying. I don't know how full-time PAT nurses do it. It is some kind of tricky. I even wrote some stuff down that I'm going to add into the fun stuff when we get to all of the crazy things people say. You can't make it up, and I try not to. I try not to get cranky, but God bless them. You really can't make it up. Like, do you have anything removable from your mouth? Well, I got some tattoos. How's that related? Are they mouth tattoos? I don't. Gotta love your patients. They are so much fun. And one day that's probably going to be me, all senile and cranky, giving someone my health history over the phone. Okay, so that's it. That's all I got for you. Face your fears, forget your failures, follow your faith. 12 minutes, not bad. Okay, well, I'll see you next time. I hope. Just do a good little freaking. Maybe if I turn it back off and on, like that seemed to help. I turned it off last time, and then I turned it back on. It worked the first time.